Happy week 7. Okay. I'm going to cover a couple of things because I was shadowing over in the palliative care or hospice center here at the hospital the other day, and we were in like the morning meeting where they discussed a lot of the patients or veterans. And a couple things came up, but it was mainly in regards to this veteran's safety. But it is a veteran on the hospice unit or palliative care unit, and his wife had just passed away at home. So he is doing well enough at this very moment that they could give him a pass to go to the home and then come back. So they were discussing that, and but they were also discussing safety around him being, not being suicidal, or that, there wasn't necessarily a potential there for him to take his life if he were to go home where he has a terminal illness as it stands. So a couple of things kind of came up. First of all, safety came up. So that was big. But in those meetings, they talk a lot about assessments, where the veterans are at the moment. There's usually a chaplain involved as far as, end of life planning, and, some of the clients that getting ready to pass, or veterans getting ready to pass, sometimes challenges or questions come up that require, the chaplain to get involved. But what kind of came into play here was this gentleman, if he was truly safe to have this pass to go home, based on the assessment that they did, where he had previously had suicidal ideations and attempts in his history, but was stating now, like, I always had a reason to push while my wife was alive, and now I feel like I can kind of let my body go. And so that presented some concern for the staff, in the sense that he's not saying he wants to kill himself, but he is saying that now he can he can relax enough to just kind of essentially let the illness take over, and he can be okay with going because his wife passed. He was being strong for his wife. So it presented not necessarily like an immediate threat of suicide, but it presented some concern that if he were to go home on a pass, could he do something potentially? And there was question about there being medications still in the home, because his history is with medications. So the chaplain became involved more so because he was very concerned about the safety and him going home on a pass and not wanting him to take his life. So there was a lot of debate going on at the table, and really kind of what it came down to was just that we have assessed to the best of our ability. We have a commitment to our veteran, so that's kind of where the ethics come into play. So we assessed, we have a commitment to the veteran, and that maybe the pass would be best suited for a day during the week versus on the weekend, when if something were to happen, even if the veteran was deemed safe, if something were to happen, there would be a lot more supports in place during regular business hours. So just kind of throwing it out there with you guys, any kind of complex, well, I'm sure you guys all have complex cases, so let's face it, we've all had them. But anything kind of stick out where kind of a bunch of different things came together, and like with an interdisciplinary team or what have you, where different perspectives were kind of going to bat, not necessarily in disagreement, but just, you know, with different perspectives and well, this could happen, well, this could happen. So I don't know, just kind of your thoughts. I think the situation was handled pretty decently. It was a pretty good outcome where the veteran could still go home and have some closure and what have you, but that there would be more supports in place and a thorough assessment done and documented in the event that something were to happen. I did check in. The veteran did go home on a pass, did come back and was fine. So it was awesome. But anyway, I hope you guys all have a good week, and next week is our last video. So this is crazy. But congrats to you all, and I look forward to hearing from you.